Hi, my name is Mallori Thompson, and I'm the program manager with the Duke Cancer Patient Support Program. I'm here today with one of our medical family therapists who is also a clinical art therapist. His name is Geoff Vaughn, and he's been part of our program for over 10 years. Jeff, how are you doing today?
I'm doing well. Thanks for having me, and I look forward to talking a little bit about art therapy.
Absolutely. So, can you take a few minutes to just describe what art therapy is?
Sure. So, art therapy is a clinical practice just like traditional verbal therapy, what people usually think of when they think of supportive counseling. But instead of talking, it's really using images primarily to explore and express a person's feelings. And that can be using any visual media. So, photography, drawing, painting, sculpture, collage, any other way to express oneself through art making.
Wonderful. So, can you give us a little bit of understanding of what that looks like here at the Cancer Institute?
Sure. So, as a clinical art therapist here, I'm able to use art therapy with individuals, with couples, with families, and in an art therapy group that we facilitate. We've partnered with the Nasher Museum of Art here at Duke to provide a patient and caregiver art therapy group.
Wonderful. So, you mentioned the group. Can you tell us a little bit more about the art therapy group that's available for patients?
Absolutely. So this is a group, again, we partnered with the Nasher Museum here on campus, and it's a group that meets twice a month. It's a 2-hour group each time we meet, and the Nasher has generously offered one of their studios and all of the material that we need to have a support group, again, for caregivers and patients to explore the themes of the cancer experience, whether it's from the caregiver perspective or the patient perspective or even the survivor's perspective. And themes that often come up are dealing with diagnosis, coping with the difficulties of treatment, the uncertainty of survivorship, the difficulty of caregiving, and many, many other topics that the participants often bring up.
That's wonderful. So, given the current circumstances and our inability for the program to offer support groups in person, what are some of the things you think would be helpful for a patient or family to do when they're at home?
So that's a great question too. And I've actually been doing this with some of the patients I've been talking to by telephone, which is how we are currently meeting with patients and caregivers. I'm having people use materials that they can easily find at home, and that is usually magazine collage. So everybody's got a stack of magazines sitting around and some printer paper, and then I'll have people get some glue, a glue stick, or some scissors, and make what I call a calming collage. And the idea is to give oneself a way to create an image that will help you calm down during very anxious times, as we are currently experiencing. And so the idea is just to take your stack of magazines and start culling through them and finding images and words that you find calming or peaceful or relaxing, and cutting those out and getting a generous stack of those images and words. And then from there, starting to move those around on the page. And at some point, a theme will develop. And that's when it's a good idea to kind of start affixing those to the page. And as you fill up that paper, you'll develop this collage that can really give you some peace of mind. And what I'm having people or suggesting people do is take that when they're done with it and put it up somewhere in their house where they can return to it when they feel like they need some reminders of how to stay calm. And it seems to be helping quite a few people.
That sounds wonderful, and I'm feeling calm myself just thinking about it.
Awesome.
Thank you so much for your time, Jeff, today, and we appreciate the work that you do with our patients and families at the Duke Cancer Institute. And I hope you all stay well, and thank you so much.
Thanks so much, Mallory. Bye-bye.
Bye.